expertise once again. We very much appreciate this. This is, again, a group that's absolutely here to roll up our sleeves and get work done to really move straight into implementation. And so I'm very happy that knowing that you've agreed to be on this work group. And again, I think everyone knows everybody, right? Does everybody know Maureen? I'm sure you all do, right? I don't think we need to do introductions. Okay, so again, thank you. So I'm going to move us right toward the agenda, and you had items for discussion, which was on the agenda. And one of the first things that we wanted to take a look at, because before we get busy marketing anything better, is there some feedback?
Corey, did you want us to do roll call first?
Oh, I'm so sorry. Yes, I keep forgetting.
No, it's fine. It's fine.
Okay, go ahead and do that.
Okay, thank you. Corey Tello,
Yes.
Mary Campbell,
Yes.
Gabby Bonte,
Here.
Trisha Malott.
Here.
Judy Buchanan. Okay. And then for staff, we have Maureen, Taylor, and myself. Anyone that I missed on the board or the mental health advisory board? Okay, great. Thank you.
Thank you for helping me out there. Appreciate it. Okay, so again, one of the first things we have to tackle is obviously our goal is to try to market services, and particularly to people who've been most impacted during the pandemic and who have for a long time perhaps been underserved, or who have chosen for many reasons not to seek services. So our communities that we really want to start building really good bridges and relationships with. But clearly capacity has to be in place before we start encouraging people to jump in. So thank you to Amy and Taylor, perhaps, who helped gather this information. So you all saw the information about the various counseling agencies that was attached to the minutes. And I don't know if anybody has comments about that. Amy, did you want to say anything about that in general? And Judy, go ahead.
Just very quickly, can we not add the triage center if we're looking at sources that maybe people can be reminded are there? Or I don't see it on my list.
I wondered the same thing and just didn't know if there was a reason that it wasn't listed.
No, probably just an overview.
Well, probably, Tricia, because we knew you would be here today and you could give us that information. I think we were trying to make sure we got information from people that, I mean, this is obviously not an exhaustive list. There's probably lots of others, including, I'm very interested in what the hospitals, because I know the two hospitals have counseling departments.
Yeah, and real quickly, when we generated this list, it was mainly looking at therapy sessions versus crisis. So it did end up having some crisis services on it because what CHS and Chestnut has, but it was mainly, so the triage center wasn't added because it was mainly looking at ongoing therapy services. And it's not a list either that is presented to the public. The list was what Corey was talking about, was because there was concern that there was going to be advertising for specific services for therapy. So we were going to advertise for therapy. And so the board wanted to make sure that there was going to be enough therapy available within the community. And so it's just a very small list of that. And we have reached out to the hospitals regarding the services, but as of now, they have a pretty long wait list too. And then there's a kind of competition between public and private insurance. And so that's why we didn't include them on the list.
Thanks for that clarification, Amy. Go ahead, Judy.
Thank you, Amy. And you mentioned we were looking just at counseling, where the people could receive counseling. And maybe I need to back up a bit. It's not part of our mission in terms of marketing just marketing help that's available. Not necessarily only counseling. You know, if you don't really know where to go and maybe you just need a phone call, is not our intent just to reach out and to have that, let people know that there is help out there. And so that, from my perspective, might include some additional agencies.
Yeah, certainly. I think we just felt that the crisis system has enjoyed better coordination recently, and triage, of course, was a huge, wonderful addition to that coordinated system. And I think they've worked together for quite a while to, get the word out about what services are available. And there's even, PATH even created, with help from the agencies, even created like kind of a crisis system PowerPoint that has been distributed pretty widely, I believe. Doesn't mean we should not be marketing it, Judy, not at all. But I just felt, I think the concern was therapy has had less of an opportunity to have any kind of a coordinated effort to talk about, having somebody like entertain a plan for what's available and how do you discriminate among one over another and all of that. So if that makes sense, Judy, does it? Why that was kind of a priority for this group. Not that crisis shouldn't be also marketed, if that helps.
Yeah, and I think as we get into our messaging and our mission, because I notice under item B on our agenda, we do reference the triage center. So
Right. And Tricia, do you want to say anything right now about services that, obviously you want all of the services to be showcased, but is there anything in particular you would want to make sure that we, prioritize?
Well, I think it's really relative to the exact direction of the marketing plan. And so in the interest of making sure that we are staying on task and that I'm responding appropriate to that, I think when I know exactly the direction we intend to go, then I'm happy to fill in and I'm happy to talk about the triage center. I just want to make sure that it's in line with where we're wanting to go. So.
Well, and, I think which is what's constantly happening because of the nature of the needs and the services right now, which continue to grow and change and intensify or whatever. Every time I think, at least in my mind, we have kind of a clear path forward, then I look at new information, like getting the information here. And would you all agree with me that clearly we have a capacity issue? And and I think Mary wisely said, you better find this out before we go too far. And so what it makes me think about is, do we in fact, instead of trying to market more formalized services, because perhaps we don't have the capacity to really do that, should we start more with the idea of like what services can stand in the gap between while you're on a wait list, or maybe because you're not comfortable with formal therapy, but you need something. So should we start more with, are there some services in the gap that we could help people learn about? And, so like, for example, and again, I'm throwing this out to all of you, but I believe that, I think when I was having a conversation with Megan last week, Tricia, Megan kind of reminded me that you and she had a conversation at one point about, could there even be something on websites that talk about particular apps or particular podcasts or particular, just sources of information that were vetted and we knew to be good and credible and all of that, that people could be directed to, that would just give them some immediate information and maybe some immediate strategies. And, and is that something that, given that maybe we don't have strong capacity for formalized services, should our efforts start there, and then we market those things? And Maureen, please go ahead.
So I'm new to this conversation, and I'm wondering, like, when we were setting up our resources for women with postpartum anxiety and depression, one of the first things we said was contact your insurance carrier, because they have a list of approved counselors and therapists and agencies where you could go. So if this list also had, a note to contact your insurance carrier, I mean, that would expand that list of available counselors and therapists, because that would open it up to private therapists who are covered by insurance. I mean, that's how a lot of people start, is they contact their insurance company and get that list.
Thank you. So just thoughts about, do we, again, thinking we were going one direction, which was to, I think the original thought was, we are going to have a sense of what are the services available for that would meet the needs of some of the more marginalized communities, and can we find ways to bridge, make those connections happen? Can we use some peers that come out of those communities to get educated on those services, and then be the ones that kind of are the link to those communities, and that some of our efforts would be to, for lack of a better word, grow those ambassadors and, empower them, and, and kind of do this in a small way at first, maybe just identify 3 communities, and, work on kind of a pilot, kind of an idea, and see how it goes and learn from it. And then, and then build it as if it's working, and after we've perhaps fixed any problems we see with it. But now, like I'm saying, I still think there's merit in that, but I'm wondering if we should work more on those standing in the gap services for in one sense, and then while we're still building that other system, which, Maureen, I appreciate it, because again, we are always talking about those with insurance, those on Medicaid, and those underinsured that, their insurance is not going to meet that need at all. So I guess in a way we've got 3 groups. And so and again, this, I'm very wanting your voices. Do we start with focusing on one of those groups? Do we start on, well, I'm just going to stop there. What are your thoughts?
This is Gabby. So my thought is, since we don't have a direction just yet, marketing should be generic, like you said, as far as reaching out to your providers. So just encouraging people that it's okay to get help, and this is what you should be doing if you're feeling stressed. So however they go about it, I think just the willingness to encourage people to make that first step.
Okay, thank you.
And Corey and Gabby, I would really support that, because I think, going back to when we first began this conversation, part of the intent, as I recall, was to make sure people knew that there were services available if they felt that need. And we refer in our agenda to both formal and informal supports. And from my perspective, that might include just having somebody that you could call, like a 211 or a triage center or PATH. And then the more formal would be specific agencies. And so I'm not sure if we need to talk about again our mission or our purpose, and then go from there? Or do we have that clearly stated?
No, we don't. And so that's great. But I guess I was trying, before we tried to like wordsmith a mission and nail it, I just kind of wanted to have some general discussion around it. Because again, if I love what all of you are saying, which is let's make sure we just help people know that there's help out there. But then what my fear is, if we say there's help out there, and then we give them a list, and then they call the first 2 people on the list and they're told, sorry, we got no openings until late November. Have we done, is that even ethical on our parts? You know what I'm saying? So I'm trying to say, yes, our mission is get the word out that do not feel that you are alone in dealing with this. Do not risk letting yourself get, sink into deeper and deeper depression because you're reluctant to reach out. So yes, I love that. I feel like that's a huge mission, like know that there's help, seek it. But then my concern is, how do we guarantee that it's there when they seek it? So that's where I'm struggling, Judy, with how, so our mission should be, yes, send that message, but then how do we make sure that there's something that's on the other end of it? Go ahead, Mary.
Yeah, Mary, go ahead.
I'm following Judy's comment. That happens all the time. You know that. We put the word out and we tell people to go here for this and that, and they go and then they don't get anything. They don't get any help. There's nothing. So I don't want to be a part of doing that to individuals who are in need of help. I like the comment that Judy made about the awareness of trying to reduce the stigma so that people will at least begin to come forward, that they will not be afraid to tell a friend, which is really their first support system, is a friend. And it also seems to me that, this is like a really good time because all the conversation is about how the pandemic is increasing the isolation and the mental health issues that we all are experiencing. This sounds like a really good time to jump on that and to get the Pantagraph to run a big story, to get WJBC and GLT to do stories about that, to get information out to churches. Churches are, until a person is really at the bottom, they tend to still stay connected to their church, but they do leave that when they are really down and out. But it is a front line. Your minister, your pastor, your clergy, whatever, is often the person that they'll go to because honestly, the real world out there is not going to provide services for them unless they're the lucky one who gets a spot. And I don't want us to be saying there's lots of spots out there, and then the community thinks, oh, well, everybody can get help. And then nobody wants to fund additional programs to provide the resources that are needed. So, it's a mental health issue, but mental health is a health issue. And we could maybe, highlighting the triage center, which was a really good article a while back as to why people have no place to go. And this is but not everybody's going to go to a triage center. And so where do they go and how can we help them? And so I think it's bigger than just saying, go here and go there if you want a service. I think that would be a disservice. I hear Corey saying that.
Yeah. And I really agree. And that's why, we have 211 and a lot of people don't even know about that. So it's that one point where you can call, and I've talked to people who've called there. They probably needed more than 211 could help them with, but at least they were prepared to say, there's a waiting list over here, or no, we don't have a residential placement for your kid, and those kind of things. That I feel good about directing people to at least that information rather than leaving the suggestion that there is something out there for them to take their loved one, themselves, or someone. And I'm kind of reminded that Mental Health First Aid and Mental Health America both have pretty robust campaigns on reducing that stigma, and allowing people at least to acknowledge, maybe I can at least talk to someone about the help I need. And that may be something that our work group wants to take a closer look at, because rather, they do speak to that, and it's something that's already done.
So I guess what I'm hearing, I realize that you all are eager to have us set a very clear course, and that certainly is my goal. I know that there have been efforts in this community already to do a 211 campaign. I believe United Way and some others were doing that. And I know Joanne Glancy at Project Oz, and I think Sally Gambacorda and United Way people and a couple other people were doing this 211 campaign, and they were calling it something about coping. And I think there were signs up on buses and things like that. They did it for a while, and then they admitted, I spoke with both Sally and Joanne in the last week, and they both said they have just kind of stopped it. They just stopped cold meeting during all of this because everyone on that committee was so busy dealing with their own, internal issues. And so I don't think we're stepping on anybody's toes if we take that over or join, get them back with us or whatever. But I have no issues with doing a 211 campaign. I guess I was hoping this was going to be bigger than that, but that certainly may be a great place to start. And again, I don't want to bite off more than we can chew. Do you all feel like we should? My idea was prioritize 2 or 3 things and then, work on them kind of together so we're having a bigger impact. Am I correct? And again, I would love all of your input. Are we assuming that 211 would be one of our first priorities, the 211 campaign? Tricia, go ahead.
So to answer that question, I would support a 211 campaign, in part because it's the push that we've made as a community in the last few years to try to direct people. And so I think it could become problematic or confusing if we try to send a different message. At the same time, do I think there are possible ways to add to it? Maybe. The other thing I was going to say, going back just a little bit, was if we went down the route of trying to connect people to specific services or specific providers, I think we would run into logistical issues, like who is then going to manage that list, and who is going to be the go-to contact person when somebody can't get in, and do they have the capacity to answer those calls and those questions, and or keep something updated. And I think, so from a very realistic logistical perspective, I think that initial idea could be challenging. Personally, and from a community perspective, I think if we work on addressing stigma, and I agree with what Judy talked about, the entities that already have like campaigns and literature and even social media designs already put together, it saves us time, so we don't have to reinvent the wheel, and it's then also a consistent message. Pushing 211, or even identifying like some of the stopgap resources. And so maybe it's even 211, mobile crisis and triage, or things along those lines. But I think we may get some more bang for our buck, so to speak, in reaching people or helping them identify like signs and symptoms when to reach out. Like, so maybe we need to help the community know when to call PATH. It's not just call PATH when you need help, but how do you even know that you need to call PATH? So maybe some of our messaging in this needs to be much more concrete. When you haven't returned, your best friend's text message for 3 days, and maybe it's not really 3 days, but you know, as an example, or when you go to bed at 7 o'clock instead of
Right, I
your
was
usual
gonna say,
10
when you-
o'clock.
Yeah, when you haven't slept for 3 days or 4 days or more.
Yeah.
Yeah, that kind of stuff. Yeah,
Yeah.
good point.
Or
Yeah.
your sleeping has gone the other direction. You're sleeping a lot now. But I wonder if giving people really tangible, real life things that could be going on tied to, okay, now what to do.
Mhm.
And
Might be a
Maureen,
good one.
and thank you very much, Tricia. Appreciate that. Judy, did you want to say something else before I'm going to then have Maureen talk to us a little bit about mental health first aid and whether some of that's built into that. But Judy, did you have something else?
I think I'm fine. Let's just move on.
Okay, so Maureen, is there any, as you've just heard Tricia, do you feel like the mental health curriculum for both youth and adult would help meet some of those needs, or even that there would be information that we could pull from that to put into some of the campaigns so that there's some, consistent language too for people that maybe have been trained in that. And again, could we have our community ambassador idea, those people get trained and all of that kind of stuff. So now I'll shut up and let you talk.
So, with mental health first aid, one of the evidence-based outcomes is that it does help reduce stigma and helps people who have taken the course think more about who are their own confidential, trusted advisors, but also how to help people figure out who to go to for help, whether that's professional or friend, family, kin kind of thing. Many people on this call have been very helpful in getting mental health first aid up and running for the last 5 years in McLean County. We have been going since 2014, and we've trained over 2,200 folks in and around McLean County. But then when COVID started, we hit the brakes because of the whole meeting in person. We had our first in-person class on last Tuesday. It was at OSF, and there were unfortunately 18 people in that room. I really wanted to keep it at 12, but there was such a demand, and they were all a good 6 feet apart and wearing masks for the whole 8 hours. And the feedback from that class was really good, but we don't necessarily want to take a chance and do 18 people again for that 8 hours. So mental health first aid nationally has now they're offering it the course either completely virtual or a blended course with a shorter in-person time. And for our trainers to use that system where it would do the virtual course or the shorter in-person time, it costs $150 per trainer, and it's a good 10 to 12 hours of online training for that person to go through that. I'm almost finished with that process, and we have 2 other local trainers who have finished that process. And so we've started, I think we've done 3 that have been completely virtual. In those virtual courses, you set a time for a Zoom training, and that Zoom training is about 5.5 hours. You kind of set it for 6 so you can give people a lunch break. And then as you sign up people for it, they need to really be signed up a good 2 weeks in advance, because they get a link through email to do about 2 hours of virtual training. Goes through slides. You hear, a person reading the slides to you, and there's quizzes and other interactive things to keep people interested. But that 2 hours is like a background in mental health problems like depression, anxiety, schizophrenia, issues involving psychosis, but also there's some on trauma-informed care and adverse childhood experiences. So it's about 2 hours. When they finish that, they get a ticket to get into that 5.5-hour virtual. It's a Zoom class. And then the Zoom class is taught by 2 instructors. So you can do that whole virtually, or you can set that 5.5 to 6 hours as in-person time. But again, those in-person folks still have to complete the 2 hours of virtual time. And so to do that in that shortened, well, it feels shortened because you're only in the class part, you know, between 5.5 and 6 hours. That costs now about $25 a seat. And we don't have any say in the cost. That's what mental health first aid at the national level is charging us. And so we've been trying to figure out, you know, could we've held the line on the cost to take mental health first aid at $10 a person for the last 5 years. And we were wondering, you know, maybe we could bump that to 15. And then again, tell people, you know, if you can't afford $15, talk to me and we'll figure something out. Because even with the $10, I mean, sometimes we would take 5 or 3, just whatever a person felt they could afford. We always felt that it was important that they pay something, so they valued it. But if that was $3, then that's totally fine. And we just covered the rest. So, you know, we're meeting on Thursday to kind of figure this all out. Whether, you know, $15 is still a good amount, you know, is that affordable to your average person? Because the idea is not to have folks who are in health and human services take the course. It's to have your, you know, neighbors
Right, okay.
and faith communities take the course.
Okay,
And-
thank you. Thanks, Maureen. So you'll
Yeah.
know a lot more. But I guess what I want everybody to be thinking about, okay, so if, as part of our campaign, if we do a 211 campaign, is most of our work just going to be about, like Tricia suggested, are we going to say, here are signs and symptoms of things you need? And we could even do there's tons of really quick little self-assessments. I mean, we could even have some self-assessment tools where where it just kind of lets you know, is your level of anxiety or your level of concern such that you perhaps need to reach out. And so we could do some like self-identify, and then also here's some signs and symptoms and things you need to know when you need to ask for help. And then where you ask for help is 211, and then you'll be directed to, whatever. But so is most of our work, should it be about like helping people learn how to self-identify when they should ask for help, and then to make that call to 211 and helping them understand what will happen when they make that call to 211, so they literally would have some sense of, when I call 211, I can expect the following thing to happen. Or should it be more about trying to have more people trained in mental health first aid so that they can reach out to their neighbors and friends, or both? So again, that's a question. Do we need to, does really encouraging mental health first aid training. Is that a part of our campaign? Go ahead, Amy.
Sorry, like I was trying to, it was weird trying to position my hand in the right spot. Maureen, do you know of the trainers? Are they interested in learning more about doing this virtually? You said it was a lengthy time for them to add on. If we were able to provide the 150 for them to do this, do you know of their interest?
We have 6 to 8 trainers who are interested. I'm not sure how long it would take them to get through that 10 to 12 hours, but yeah, we do have many trainers that are interested.
Then I'm wondering with, and I know Maureen and the mental health first aid collaboration does a lot with advertising mental health first aid and trying to do that through outreach and getting especially just like the normal kind of Joe in there to learn about mental health. So what about also maybe not, what about marketing on the community members doing mental health first aid virtually during COVID? So I know we would have to wait until those 6 to 8 trainers got able to provide it, but there is, like what you guys were talking about before, not that I'm against marketing for 211, but there's plans and things in place now that's marketing 211 and advertising. What about advertising individuals to complete mental health first aid? And so then that way their friends and their neighbors can help each other.
Go ahead.
I don't know how many years ago, Maureen, I took the mental health first aid. It's absolutely excellent. And there were a wide variety of people in the class. It was when we could still be in person, but it was excellent. And I, that's my field, and I was still impressed with the quality of the content that was being provided. I wish there were more of them. I've tried to get interns and others to sign up, and it's always filled up. I think it's an amazing opportunity for anyone who's interested in being a good neighbor, a good friend, a good church member, a good local counselor. Most of the people who do counseling or who do human services really don't have a direct counseling background of that level of mental health awareness. So I would say anything we can do to support the effort that Maureen's project does would be well worth it. And I have a question. Could someone tell me what happens when someone calls 211? I'm calling 211 because, I'm scared I'm going to take my life, or I'm, so angry at what happens when I make that call?
I guess, Mary, I'm perhaps one person that could answer that. A family member has called 211 quite often. And at times they've just, suggested who they might go to or call next, or they've stayed on the phone with this individual for 20, 30 minutes to kind of just, sometimes someone just needed to have somebody who would listen to them. And then there was a time when they were calling inappropriately and they were told so, that they'd really have to, there were other people waiting that had more urgent questions or need for help. And so they were told, to just kind of do something else. So that, and again, I have encouraged this family member to continue to use that, because quite often it's kind of almost a short-term fix that you're not alone. At least that's been our family's experience.
And there are people who call 211 every day. But if a person calls and they are in crisis, that 211 worker will find out what the crisis is, and if it's a mental health crisis, they'll keep them on the phone, and they'll get in touch with the crisis team over at the Center for Human Services, and they can connect that person to the crisis team directly, and step out of the call once the crisis team person is on the phone and ready to talk to them. So, you know, they have various tools at their disposal. They also have a teen services through Project Oz that they can get in touch with, and again, directly connect them and step out of the call once they're connected.
Thank you. I wasn't aware of the depth of opportunities for someone who would make a call. That's helpful.
They ultimately have something a little bit like a decision tree that they sort of operate from based on information that the person gives, so that they kind of know what path, no pun intended, to go down with the individual. And if the person expresses any suicidality, they have specific screeners that they're also using on the phone with that person, because they also answer for the National Suicide Prevention Lifeline. And so I know that they have some specific screeners that they're using with them, but like Maureen said, they also can directly connect the person to mobile crisis, or refer them to where they need to be. But they have a little bit of a decision tree too. So
They track every call for what type it is, whether it's crisis support only, you know, direct need for resources or whatever. So, I mean, they really do have obviously very, they match the connection to what the identified need is, and obviously do it quickly. So, okay, so what I'm hearing right now is we have a two-pronged, right now I think we're gonna start with a two-pronged effort, with one being, again, doing a clear identification of how people can help identify when they need to reach out. That 211 is what we're encouraging them to reach out to, so that they can be directed to the best match for their need. And then the second prong will be marketing mental health first aid and youth mental health first aid. So, and I think, again, Maureen will know more Thursday after she meets with her collaborative that's going to talk about that. But I think we have to decide then, first of all, Maureen, can more people be served if it's all online? If you could do a completely virtual class, if that was one of the options, how many people can be taught at one time? Could we
can have
make it
up to 20 people in each course? But because we're not
20
limited by venue, we can have, you know, courses more often, I guess, or in, yeah, when you're not limited by a venue, you're just limited by when your instructors are available.
But I mean, when you're all virtual, can you take more people than 20 because you don't have to worry about anything? I mean, or is the company still saying you can only do 20 maximum?
It is limited by the National Council for Behavioral Health at 20 per course with 2 trainers.
So I guess, again, I'm throwing this out there so everybody else jump in. So I guess what we're going to want you to ask your people on Thursday is, you said right now you have 3 people that are trained in the hybrid and online models. Okay, so ask those 3 what their capacity is to do mental health first aid trainings. And does that include youth? They're also trained to do the youth one as well?
2 of us are trained to do youth, yes.
Okay. So, and then I guess how quickly can your other trainers be up to speed on that? And then what ultimately would be the numbers we could offer? And then I guess as part of this group, if we've already said we want to try to identify, you know, more high risk areas, then is part of our job like trying to identify where can we market in particular so we reach people in the communities, you know, and really get some people trained in those communities that we're talking about. And, you know, whether, if that's in person, where would it make sense? And so I think we're talking about communities of faith. I think we're talking about, you know, Trisha, you had brought up the grants for barbers and, you know, beauticians. I think that would be another amazing audience. I think, you know, last time we talked about, you know, even some of the people that are, you know, congregate living residents, advocacy organizations, so that anybody that's doing any kind of advocacy, food banks, that although like you know, I'm just trying to think where, and other people like Head Start and some of those places. And again, I'm guessing this is not new work. So again, I'd be interested in all of your thoughts on other targets that we should maybe think about to offer mental health first aid training to if they're interested.
This is Gabby. Just talking about the different populations. I mean, as far as just seeing what's going on, I believe at this time parents and children, especially parents, are under tremendous stress, more so than any other population, with the kids being at home and just things like that, having to work and be educators and everything in between that.
Right. Yeah, educators certainly have been under huge stress. There's no doubt about that. Yeah. Other thoughts about certain groups that we should be trying to start creating this relationship of, you know, helping feel like we've increased their skills so that they can be of more targeted help? Any other ideas? Go ahead, Judy.
And I believe we did talk about the WIC and the Head Start program. And we talked about in community liaisons, people that maybe like Eastview Church, Boys and Girls Club, Better Birth Outcomes, some of those places that are probably in contact with people who may not be as aware or know what to do. But the community liaisons do. Should we take on the responsibility of identifying some of those and create a path for them to do the mental health first aid, with the intent that they're kind of in touch with their community? Because we've talked before about, you know, you have to look like and talk like and think like the person in the community you want to help. And so these liaisons, if they were prepared to be a more informed listener and not provide counseling, but at least know, oh, you should do this or that. That in addition to the 211. But that the community liaison piece, I think, you know, as I think about the kind of resources we have, that and 211 probably, and doing mental health first aid, that would be a pretty significant campaign, and maybe even beyond our means. But I don't think we should worry about that. I mean,
Well, and that's why I think the
we'll
community,
find the money unless it's hundreds of thousands.
well,
Yeah.
that's why I was thinking the community liaisons, we start small, and because I think we want to give them enough support that this, you know, this is done, again, kind of in an evidence-based way, and they have plenty of support, and we also learn from it. I think anything we do that's new, we should think about it in terms of, you know, being very much about learning from it so it can get better and better before we take it to capacity. Amy, go ahead.
Go ahead.
Is there, Maureen, do you know if is there an opportunity for us to try to train more trainers to be able to, so if the capacity is at 20, even if it's virtually, and I know like last August, pre-COVID, not this August, but pre-COVID August, you had a training for training the trainers, but would it help for some of this money to be used to train more people to become trainers?
So to bring a train the trainer to our community, or, you know, to open up 16 slots for people to learn is about $24,000. So it's not inexpensive. But yeah, I mean, it's certainly a possibility. It could, yeah, it's a possibility.
It just sounds
It would
like
just
this might be the opportunity to do some of that too.
Well,
It's finding enough people who want to do it, you
Well,
know?
Sure. And I think Corey mentioned earlier some kind of a pilot project, and some of these are good suggestions if we structure this in such a way that we really do want to learn as well as provide a service to the community. Train the trainer sessions. If this appears to be serving a function, we maybe have a campaign to raise the kind of dollars we need to do. But we start small, but making sure we build into it something that is measurable, something that we can document has been done and what appear to be any of the outcomes.
Go ahead, Tricia.
Maureen, are they offering any type of virtual train the trainers right now? Like given COVID, because I'm just wondering if they're doing that, do we have to have as many people ready to go, and is the cost as high? Is it perhaps a cost per person if they do it virtually?
It is all virtual training right now. They're not doing any in-person trainings. And so it's 3 days plus probably 2 days of prep work. And I believe that it's $2,200 per person. It might be a little bit more than that.
To
Depending.
get trained? To get
Yeah.
trained. Okay.
So it's usually less overall to bring, to host it. And the other thing about hosting is that you can sell some of those seats to other to other people at that $2,200 a person, or $2,000 a person or whatever. So if as a community we find 10 people, we could sell those other 6 seats, for around that $2,000 to $2,200 a person, but we have to find the people who want to take it. So yeah, I mean, I didn't think about that, but yes, Tricia, we could look around for seats in other community trainings, and they generally sell for $2,000 to $2,200 a seat.
Sorry, go ahead, Mary.
I can't think of anything better to do with $24,000. When you think about the ability to disseminate this information to the trainers, and then those trainers disseminate that information to their classes, you're having a massive impact across many segments of our society. It addresses youth issues, it addresses adults, senior citizens. I mean, it's pretty comprehensive. And so I think it's a great use of $24,000 or whatever it would cost, Maureen. And also I was thinking about, some of the areas, we've seen some really amazing youth activities this past year. And I know that like Youth Global Citizens, that's under the Multicultural Leadership Program, they would be a great way to reach some of these amazing young people who have finished their program and are clearly servant leader oriented. And so that might be an avenue to get people in and trained. And I was also thinking about the NAACP is very active locally. It has a large group of people that they send their information out to. And and many of them are professional people in the community who are committed to improving the quality of lives for their members and for the community at large. So I think, I don't know how much money we have to work with. That's not my area of expertise, but boy, that seems like a really good use. Oh, and the other one I was thinking of was the National Alliance for the Mentally Ill local support groups. They have I believe they still have one for families who have a child and who has mental illness, and also for people who are adults who are having issues with mental illness. So you have a lot of groups if we could get the word out. I recognize Maureen's issue is how to get people who want to be trained for what, 4 or 5 days and then do this. I don't know if do they get reimbursed for any of this that they go through, or they just get a certification that says they're trained. Do we pay them? Do they get any kind of payment once? No, it's all free. It'd be nice to have a stipend for them once they are providing the class. Maybe they take the training for free because that benefits them, and it gives them another certification to add to their professional, bag. But maybe once they're trained and then they're offering these classes, maybe we, a $200 stipend or something for offering that day would be a nice incentive. So that's all.
And I do know that once you're a trainer, in order to maintain your certification, you have to do you have to offer 3 classes every year. Is it, Maureen?
Yep.
Yeah. So, I mean, that does give people, the trainers, incentive to want to do it again if they want to maintain their certification. But I agree with you. If we're going to identify some people in the community to be trained and become liaisons, it does seem like some sort of a stipend for them, giving their time to be trained would be important. So that's where I'm kind of looking at. Now, Maureen, you used to have like a grant through AHEC that helped pay for some of this. Is that ongoing, or is that over with, or is that something that could be written for again? Help me with that.
AHEC, they sometimes Sharon Mills from AHEC sometimes will put that into her grant request, but AHEC's money has been shrinking. It's a federal grant, and it's been less and less each year, and so she hasn't always had the flexibility to put that in there. And then the last time that she put it in there, the money didn't come through. They funded a lot of the things in her request, but they didn't fund the request for mental health first aid train the trainer. So we had to cancel that one.
Okay, so we have $25,000 right now set for this. And I think that we actually set aside 50,000 that was supposed to be doing marketing and sustainability. And it's possible that, I guess, that we could take, 35 for marketing and what would that leave? 15 for sustainability or something like that, if everybody's in agreement. So we maybe got a little bit more than 25 to play with. But go ahead, Amy.
Oh, sorry, just real quick, and then you are correct, Corey, about the money, but as far as the sustainability plan, just a reminder, like that group right now is just myself and Lori Walrab, so it's probably gonna be really hard for us to move that much money. So like most of the money should probably be moved from this group.
So, and again, maybe this isn't the best use of our time right now because we're kind of going into details before we've fleshed out the bigger parts. But I mean, I just kind of wanted you to get a sense that there could be some dollars for some stipends, depending on how many we start with. So I think in order to get us to a concrete plan by the end of our time, I think we want to move to, okay, so we now know, let's stay with mental health first aid right now and kind of finish that out. So we've now said we want to, first of all, I think when you meet Thursday, Maureen, if you can get back to us with a very concrete, if you can very concretely tell us how many trainers are on board and will stay on board through getting their training to do this both remote and in person, and then what you believe to be the number of trainings that could be given for, starting now and going through 2021. If you could literally map out how many trainings might be able to be given with existing people willing to step up and either already able to do it or get the training.
Okay.
So what is our capacity? I guess, what is the total capacity of people doing 20? You're saying it could be 20 ahead if it's done remote, but if it's done in person, you're wanting to keep it around 12 to 15, right?
Yeah.
Okay.
Yeah.
And so a sense of that. And then is there a need, based on what you find out, will there be a need to train a whole nother group of trainers? Because that will help us decide how this money should be disseminated. I think we all, without taking a consensus vote, I think we all agree that there should be some sort of a stipend for people we're going to identify as these community liaisons, if they agree to take that training. And then do we also want to make sure that as part of them taking that training, that we ask them to commit to a certain number of activities as a follow-up to the training, so that we know they will, they will commit to, meeting with a certain number of people in their neighborhoods, or helping us disseminate, information in some way. I mean, but I think if we do a stipend, I think it could be realistic for us to ask them for some sort of a commitment for a period of time. Do you all agree? Because I would hate that people would say, oh, I'd love to take that, and then we never see them again after the training's over, which we all know happens for sometimes very legitimate reasons. Okay, so then part of our jobs, some of the work we're going to have to do is, again, map out a mental health first aid training plan that goes through 2021. Then we need to map out costs for both trainers and stipends for participants. And then we need to identify who's going to be the audience, who's our prioritized audience, and then how we go about getting them, how we go about our first marketing will be marketing to them that they really want to do this. And then again, looking at what's that time frame, because I guess almost that's got to be almost first. We do have to have the trainings in place, but we also have to get, how quickly can we get that done? So we have people identified, and they've got time mapped out in their schedules to be trained. I guess right now I'm thinking we're better to offer a larger number virtual, or is anybody in agreement with me on that? Just because then we don't have to worry about, if things get worse in the winter with the flus kicking up, are we gonna, have to shut down anyway? So I would encourage Maureen to, maybe have make sure that there's a higher number of maybe virtual trainings. Okay. So does that make sense so far? Go ahead, Tricia.
Well, I just wonder, and I had the thought before there was the question and discussion about it being virtual, but I know one of our discussion pieces relative to marketing throughout the whole thing has been making sure that we reach different populations, different parts of our community, making sure that we're not just always targeting sort of the same and we limit attendance, but we also intentionally try to partner with a space or location in different parts of our community. So like Mount Pisgah comes to mind, because then we're on the west side, they have a bigger space, we're reaching at different populations. So I wonder if we do a couple that we're really being intentional about maybe trying to pull from different segments of our population, or maybe even one rural, because we talk a lot about how are we going to reach the folks in the outlying parts of the county. And we always have things in Bloomington Normal because it's easy, it's by default, it's where so many of us live. But do we hold one, I don't know, at a VFW or something in one of the small towns, or one of the fire departments? Is there a point in time where we could maybe make use of that space? So I want to throw that out as even just future food for thought. I wouldn't want to forget that piece, but just wonder if we can do a few that would be in person to be intentional about who we're targeting.
Mhm.
Well, I love that. I love that idea. Plus, I do kind of like the idea of if we identify like 3 to 4 liaisons to start with, it would be lovely for them to be in person so that they could get to know each other a little bit better too, because again, my idea is to support them together through this whole process. Go ahead, Mark.
So we do our best to reach out to rural communities, and we have been in Colfax, Lexington, Chinoa, and we're happy to do that. And I'm thinking with the virtual classes that it may be easier for our rural friends to actually participate. But yeah, we're happy to go out there when we can. It's just when we're in person, we really need a minimum of 10 people to sign up for the course, because generally 2 out of those 10 will not show up. And if we have a class that's any smaller than 8, the class goes so long because people feel so free to share and to overshare that it's difficult to have to maintain control over that class to move it along. So we love to do rural communities, but we just really have to have a good 10 to 12 people to sign up before we're willing to go out and do that. So I would say for the rural folks that the online version is probably going to be a better option. But
Okay.
yeah, I've been reaching out to Mount Pisgah. Corey made a connection there, but the nice lady hasn't yet called me back.
Okay. Go, Mary, go ahead.
Yeah, thanks for bringing that up, Tricia. So when we reach out to like Chinoa or something, do we have a partner organization in that community, like a church or the fire department or whatever, that helps to arrange that? Is that how you get the people in?
Yep, library, school, faith community. Mhm.
Great. Great.
Okay, so I think we're maybe ready to start talking about, let's prioritize what are our first contacts going to be to kind of build these, to really think deeply about what communities are we wanting to connect with. And I think we've already said we definitely want to do a faith community. So is it Mount Pisgah, do we want to target 2 or 3 and see, if we have more interest? I'm wondering, our church right now is doing a joint Bible study with, it's African Methodist, it's the African Episcopal Methodist Church, and they seem to be very interested, and that might be a good group to reach out to. So maybe we could do them and Mount Pisgah. Does that sound reasonable? And then let's go to.
And if you, I was
Go
just
ahead.
going to say, if you need a third one, if one of those isn't able to, the Center of Hope is on a different end of town. It's
That's a
located
great
out on South. And there's a lot of activism within that community.
That's a great idea. I'm also thinking, now let's kind of go to what Gabby's point was. Let's kind of think about families, parents, kids. And I am thinking about kids not in our schools. They've already got some kids that are very passionate about that they've really already kind of grown a little bit. So I wonder if some of those kids, but again, how old do you have to be a trainer, Maureen? Are there age limits to be a trainer? Or, obviously we're going to train them, but I just wondered, just for future references.
You have to be at least 18 to take the course.
Oh,
And
even for youth, even for youth too?
right, because the youth is targeted for adults who work with youth.
Okay.
And there is a teen course, and that has to be worked through with schools. And right now it's pricey.
Okay. All right. We won't go there right now though. So then what if we think about our Head Start groups, our Better Birth Outcomes, our WIC groups? Does that make sense to maybe for parent? Anybody else come to mind?
The
Okay,
nice part is like 2/3 of the health department is already trained. Head Start, about 1/3 of their people are already trained.
so you're
Children's
talking about their
Remedies,
staff,
they've
you're
made
talking
a
about
big effort.
their staff? Okay,
Mhm.
super. Okay, that's great. Let's go to, let's see, Mary, you had mentioned, NAACP, right? Okay, let's think about other let's do advocacy groups. So let's do NAACP, let's do NAMI. What else? I mean, again, we could do not in our town. And I don't know whether there would be, is there anybody that's kind of representing Latino, Latinx community? I mean, Western Avenue, obviously, but I mean, we could think about that.
Yeah, there is a small organization. I can't remember the name, but I remember recruiting a member for another group. Mary, have you heard? It's just a small group of people who have Hispanic roots and heritage. Is that ringing a bell? No? Okay.
No, but I think that's a great direction to head, and I'm sure that someone at Western Avenue could give us a contact person.
Well, and
Yeah.
we in the health center, are we still using some people who help with interpreters? And I believe it used to be someone from Western Avenue. So that would be a perfect type of a person to speak to.
Mhm.
And Western Avenue should be there. I mean, it's one of the oldest and, richest in terms of history.
Go ahead, Tricia.
There is a group, so at one point, like when Brenda Huber was still in town, there was a group of us that were addressing needs in the Latinx community. And there was a specific group talked about in one of those meetings. So I'm gonna pull through my notes and see if I can come up with it quickly, because I can't
Super, thank you,
mentally
thank you, thank
remember the
you.
name.
Thank you. Okay, so do we want to target rural communities? How would we, I mean, do we go with, what's the best connection to rural as far as like, I know like we talked about locations, but as far as like, who would be a good point person or contact person to start off with in rural communities? Would it be council members, city council members, the mayor? Would it be superintendents? Would it be?
It's probably different in each community, as I'm thinking. In some communities, it might be the most revered, parish priest or minister. Other places, it might be someone, a coach maybe, or someone from the education community. So I think it's going to differ by community.
And, I have to say, would it be police or fire department? I know, Tricia, you've mentioned that several times. I know fire department, that's where people do like hang out sometimes. So would it make sense to do fire chiefs or in rural areas or police chiefs?
Could we talk to Brian Moore? He's the fire chief in Bloomington. He's a member of the Mental Health Advisory Board. And I'm sure he has colleagues that maybe kind of share with him what we're trying to accomplish here, and he might be able to help us.
Thanks, Judy. That's a great idea. Okay. What other prioritized groups? I don't want to get too much bigger because we want to make this manageable. So we've got church, we've got parents, we've got advocacy groups, we've got rural. What's another prioritized group that we should not forget? I'm trying to think where some of the, go ahead.
I was just thinking that Tri-County Schools services all of our outlining areas, and they have probably a rotating team of school social workers, school psychologists, who might be able to identify within their surrounding communities who would be a good person to contact.
Super. And yeah. And they've got people trained to do mental health. They've got I know the director of Tri-County Special Ed is trained in mental health first aid. So he could even we could even be asking them what they've got planned for trainings too. So that's an excellent point. Thank you so much. I feel like we're missing like another neighbor. What about the barbers and hairdressers? I mean, is there a way to go in through that? I'm trying to think who is there. Do they have a group that kind of connects them? I don't know.
Anyone for that, but I don't think we've addressed the aged population,
Yeah, seniors.
the elderly
So
citizen population.
should we talk about senior centers? Should we talk about congregate living places? What are we thinking?
I was thinking of the area agency on aging might be
Okay.
able to identify some people
Great.
who are, yeah. And then there's the program through, I think it's the YWCA still has that program of senior
yeah.
retired,
Yes.
blah, blah, whatever that is. Yeah, they do volunteer work and they're active, and then there's the other organization. It's a faith-based one where they go out and help take people on rides.
Faith in Action.
Yeah, Faith in Action.
Thank you, Faith in. Yep.
And we do have a specific course for aging. Like it has different slides
Okay.
and different resources.
What about the disability community? Is there anything we should do there, like Easter Seals or, and do you know, Maureen, is anybody from Easter Seals or any place like that a trainer?
Not trainers. Mark First has made a significant effort to get most of their staff trained too.
Okay,
So I would say 50% of Mark First staff are trained,
okay,
but I don't know about Easter Seals.
okay. So what, are we missing anything, missing any other critical community, neighborhood? I'm trying to think, you know, I trailer parks and some of the low income housing centers are very impacted often. And I don't think seek help a whole lot. I wonder who might be contacts for some of those low income housing. Well, would that be Bloomington Housing Authority? Would
Yeah,
they?
Just
help?
gonna, that might be worth a call. I would suggest, I was just going to suggest that.
Okay. Okay, well, I think we got plenty. Do you agree, or unless anybody's thinking of some, Bernie? So,
Year,
what's that?
at least for the first year.
At least for the first year, yeah. Go ahead, Tricia. And my hair's on fire right now, but that's good. I like it when it's.
The name of the group is Conexiones Latinas de McLean County.
Oh, yeah.
And I don't know, I mean, I have no idea what their current status is, especially given COVID. They do have a website, and so it's at least still being paid for. But from everything I know, I mean, it was kind of a grassroots group that kind of came together to form a nonprofit. And so, but that's the group that I was trying to think of. And to my knowledge, they're the most formalized kind of group and connection point.
Thank you. Do you have, I know you said there's a website, so, but
I'll email you.
that'd be great. Okay.
Yeah.
So.
They're listed with PATH too.
And they're, oh, wonderful. Okay, super. Okay, so is our first step, again, I'm not sure we have time to get into all the nailing all the details right now, but I just kind of want to get some general first steps. So I think obviously the first step is Maureen to get us a lot of information. I think the next step is to, as far as trainers and some type of a realistic training schedule. Then I think we need to start reaching out to these groups and first we're going to have to like write up a little proposal of what we're going to be why we're contacting them and what we're hoping that they agree to. And I think what we're hoping that they agree to is that they will identify some people willing to be trained, and with this training, do a few things within their communities, with their chosen fellow, citizens, to advance the cause of people seeking help when needed and knowing when to. And then I guess once we hopefully have them help us identify people, then I guess we maybe do a Zoom call for all those people and, really kind of start talking with them a little bit more and then get some things set up. So our other big thing obviously is going to be what's realistic in terms of cost, and do we feel that there are other sources of funding we should seek for this in addition to the money we have? If we are going to, what's a realistic stipend to give these liaisons? How many liaisons are we going to start with? I mean, we've identified 1, 2, 3, 4, 5, 6, 7 groups. So I'm not even sure that we should start with 7 liaisons. That might be more than we can bite off. So, but I think we just kind of need to see what kind of a response we get from each of these groups, and then we'll kind of prioritize which ones are going to bubble up. I think, do you agree with me that 4 is probably the most we should start with? And is that even too many? What do you think? Yeah, what do you think? 4 or less? What's everybody think? Anybody want to weigh in?
Well, 4 is a manageable group, and the thing about liaisons is they're going to need a one-to-one person somewhere who's going to, be their connection. And then they'll probably also need to meet as a group occasionally. So they're going to need a little bit of management. And so the bigger that group gets, the more management that needs.
And I think, Amy, help me out here. I think Amy and Taylor, we were hoping would kind of be those point people for them. Is that realistic, Amy?
If I understand Maureen correctly, you're not stating like coordinating things. Maureen, are you stating like if they are a trainer, then they would need to have another trainer kind of like help them? Is that, maybe I'm not understanding correctly.
If they're actually trained for mental health first aid, then I can act as the coordinator for the training part. But if you're talking about the liaison part where they're doing more than just mental health first aid, that goes beyond my job description and certainly beyond my capacity right now.
Okay.
And before we go any farther, let me clarify. Okay, these 7 areas in the community that we identified, I guess my thought was we wanted them to be trained in mental health first aid, not necessarily become trainers. Is that what everybody else understood? Okay, that we're not expecting them to be trainers. We just want them to be trained. So, and then what we want after they're trained is to have certain activities that they've agreed within their neighborhood areas they would facilitate, or they would, reach out. So, and that's what I guess I'm asking you, Amy and Taylor, is that something that you could be the ones that you would kind of be their point people to give them some direction and supervision as they start learning how to be comfortable doing that? And, and maybe it would even take some partnering at first. And so that's what I'm asking you, is 4 a realistic number for the 2 of you to be able to kind of become supports for?
I mean, we can try, see how it goes.
Thank you. Music to my ears. Okay. So, so then we'll narrow this down to 4. And so everybody be thinking about it, and I'll send out, I'll send out something to have you weigh in on, but just so we know. Okay. So do we have our first steps? So we're getting information about the training. We're going to think about the money and I want to go back to the money. so we kind of know now we're getting people that are going to be trained in mental health first aid and youth mental health first aid, and then they will work with their communities. And they will have support from Amy and Taylor. Okay, so now let's go back to the money. What is a realistic stipend for people that are going to sit through a day of training and then commit to, I would say, at least initially, we would want them to have, wouldn't you think, at least 3 or 4 contacts within their communities at fairly close intervals, so there's some momentum that gets built up. And part of it is, we could have this 211 campaign where we give them materials, or we help them know where can you access it on a website, or where can you, where can they find it, or whatever. So, we'd be sharing with them also some skills in, accessing resources that they could then share. So if we ask them to be a resource sharer, a cheerleader for getting help when you need it, having some knowledge about 211, I think we'd also want to make sure they really knew a lot about 211. So there would probably be kind of another, not nearly as intensive training, but a little bit of training on, what 211 would entail and some of these resources. And then going and doing it. And then, being that point person for their community. What's a realistic stipend for that? That sounded like a lot. Do we think $1,000 if we again spell out very clearly that there's certain expectations and check-in points where if they're not doing it, and the money they don't get it all at once, they get it after certain activities. Is that reasonable? Sorry, go ahead, Mary.
I have a question for Maureen. Do the people, once they're trained and they go out and do they're required to do 3 trainings a year, in a year's time in order to keep their certification up, do they get any stipend for doing those trainings?
We've talked about it, but it's never worked. So way back when Laura Beavers was still at the health department, she was building that into the mental health budget, but she left before we could get that settled. And so I feel like if trainers got even, $150 as a stipend, that they would probably be more willing to step up and do that, especially on Saturdays when community members are more likely to take the course.
Yeah.
But we've never been able to make that work with budgeting.
So when I was talking, I think I said earlier about a stipend, I was actually referring to giving a stipend to those individuals who take the time out of their lives to provide the training. And I think that's much more manageable to have money flowing to them than it might be. It seems like it's taking off a big bite to try to provide a stipend to the individuals who take the class. That might be almost unwieldy. And it also might be problematic.
Mary, I'm just talking about for our 4, whoever we identify as liaisons. So it's not just that they're going to take the class, they've also committed to taking on this role of liaison. Yeah. No, I'm not suggesting that everybody that takes the class gets a stipend. No.
Okay,
No,
I was
neither
like,
were
oh my.
we. Mary, we were talking about giving a stipend to the trainers who trained. So because we do have trainers who really want to train, but either their agency isn't as supportive of that as they used to be, or we are trying to schedule courses on Saturdays and people are happy to train as part of their work day, but they don't want to give a Saturday. And so, sometimes those Saturday ones are really hard. Those end up being mine. I teach those, and our AmeriCorps member teaches those, because our other trainers just have too much life to live on Saturdays to give that time.
Okay. Thanks for the clarification.
Yeah, and I, again, for what we've set this money aside for, it really is for marketing. And so, I don't know that we want this, and I don't know that we want to start something that we wouldn't be able to sustain, to start paying trainers. Not that I don't think, oh my goodness, most definitely they deserve it. But I'm wondering if we should be seeking some other funding source for that, even, and I don't know if there are ever any grants through NAMI, or, it seems to me like, or whether there's, any other through, go ahead, Mary.
Well, I don't know if it's old news, but I heard earlier that there was money through the John M. Scott, whatever it's called now, the John M. Scott Foundation. And certainly this is health related, so it may be that we could check with them and see if there's money. Holly Ambule mentioned it at a meeting one day, and so I that's the only health related one that I can think of. And of course, we now have Carl, who is getting the word out in the community and investing in the community. So we may be able to find some funds through Carl Foundation.
Thank you. Great idea. Rather than spend, this is all wonderful. Rather than spend more time on this though right now, let's just kind of decide, for right now, what I was trying to get at is what might we pay these people we're going to build that are going to become community liaisons. And so those are the people I was thinking about, that just those 4 people we're going to start with could perhaps get $1,000 stipend each, as long as that stipend also pays for, they're going to get that to take this training, but then to also do something with it. And we would have those activities very spelled out, and they would get, the money would be doled out, after certain activities, so that, there's some accountability built into it. What does that sound like to y'all? And I just throw $1,000 out just for discussion purposes. Go ahead, Tricia.
I don't know that I have an immediate amount that comes to mind, but I agree. The language I would use would be a performance-based incentive or a performance-based stipend outcome. But I like that idea, so that, portions of it, and maybe it's on a quarterly basis. This is the amount that is eligible on a quarterly basis if these objectives are met in this quarter or each quarter, which is the direction that a lot of funders are shifting toward, is that things are performance-based because they want to see measurable outcomes. And so if we set it up like that, that's consistent with that, and it maybe feels or sounds a little bit better than holding people accountable. And we are, but it may just resonate or feel a little bit better. So it might be just
sound so controlling. You're right. It doesn't sound nearly as controlling.
I have no thoughts on the total amount though. I don't know.
Okay. So I think, so what other costs might our marketing campaign have? So we know we're going to have to do some, we talked about getting some sort of, get stuff on websites, get stuff on buses, get stuff in, we talked about, in the rural communities, get it into the firehouses, get it into the churches, get it into the grocery stores, get it into the convenience. We talked about convenience marts in certain, communities, get it into the food banks, get it into, any place where people are going to get assistance for other things. So we have to think about what would the cost be to have that kind of signage and, running ads, wherever we think we should run ads. But again, social media obviously is got to be huge. So what are your thoughts about that? Go ahead, Judy.
And is what you're talking about getting out, is that the general 211 message? Okay.
You're right. I kind of flipped on us, but yeah, I mean, I think there's a different message that'll go out to try to encourage people to become liaisons, and then they'll have a different, I mean, that we'll almost have a marketing campaign for them that's going to use some of the same stuff, but also have a different vibe to it. I would think a little more personal vibe.
We got
But
a targeting campaign for our liaisons, and then we're just trying to send a message across the board to everyone that there is that hope and support and help with this telephone number.
And Tricia, is the 211 campaign, is that something that fits under any budget related to behavioral health in the county? You know, just the messaging around just use 211 and, you know how to help yourself. And certainly we can play that up big at the forum.
We don't have any specific budget for, I mean, it's not something that has currently been budgeted, at least from my end of things. It is also, there's not adequate funding currently in what I've projected for 2021 for it either.
I'm not surprised.
Yeah,
Yes,
and
Judy.
the United Way campaign, where you, in fact, I think we need to look at some of their model too, because they've done phenomenally well in rebranding and providing a needed service. You said that they had been promoting 211, but kind of backed away. Did they do that because they did not have the resources? Do we know? I mean, had they put together any kind of a plan for pushing that out there? And if they did, is it something we should take a look at?
Well, it was really interesting because when I talked to both Joanne Glancy and Sally, who did a lot of the work on that, she said it just literally kind of stopped because everybody got so busy within their own organizations of having to deal with, you know, building all the stuff they had to build and adapt during COVID that they just no longer had time to even put energy into that. So it just seemed like, and I asked them, I said, well, is it something that could start back up, or is it something that we could tie together with? And it was interesting. It was almost like, well, it's just, it's kind of not existent anymore. But I'm sure but I mean, I know they put on buses, and it was something about having trouble coping. And then it said, call 211. And I think it showed a person with a, you know, stressed face or something like that. And
I'd like to, I think I would like for us to maybe to have some idea of what they did do.
sure.
Because there are people in this community who might be willing to, you know, for an in-kind or a small amount of money, help us put together what looks like that marketing campaign, social media, buses, electronic signs. And sometimes they have access to people who will provide some of that, you know, as a community service. So
Well,
I'd
it's
like to
probably,
see what they've
yeah.
done.
And I know, you know, ISU always, they talk about some business courses at ISU where they will take on a project, and but it's probably too late for us to get that for this school year, maybe. But maybe we could get an ISU class that's, you know, wanting to help with marketing, help us with that too next year. Okay. So obviously we want to reach out to United Way and figure out where that is and what's already existing that we could use and build on.
Yeah, because I'm sorry, they could be a strong partner, and I don't think we want to run the risk that if all of a sudden we start pushing this out and they had some thought that they would like to revive it at some point. I'd rather see a partnership there than have there be some kind of appearing to be a competition with this program.
Yeah, I agree. That's why I was really surprised, because both Sally and Joanne acted like it's just not even there. So I don't know, but I didn't meet with anybody United Way, so we'll find that out.
And just by way of following up on something Mary said, Carl is here. Carl Foundation, OSF has got a foundation, but both of those entities have a major marketing department. And there again, a pitch to those types of individuals might be helpful if they would either put it out there with their resources when they advertise as a part of it. So I think that there are a lot of ways we could explore getting the word out with not without having to invest tens of thousands of dollars.
Excellent point. I didn't even think about the marketing parts of the two big hospital systems. That's a great idea. Because it would seem to me that that would tie right in with what they, that would tie into their mission anyway, it would seem to me, or their business model or whatever. Yeah.
They're out there trying to do it.
Okay. All right. Any other thoughts on marketing partners that we should, connect with as we start building this? Mary, go ahead.
I would say that it's still possible that there may be some programs within the even the graduate program of marketing at ISU, or the undergrad program through Deborah
Helprin.
Thank you. Yeah, that they may have a couple of students who are still looking for a project, but also when we were advertising our classes recently for the Startup for Dreams Are Possible, we don't have a budget for any kind of marketing, but and everything where we used to post it at laundromats and places like that, that's all gone. So not to make, still the laundromats are open, but not much else is open. So we just got hundreds of flyers, and the food pantries all put them in their grocery sacks, so that each person who picked up a grocery sack at the Center of Hope or at Holy Trinity or wherever, and you can do that in the outlining areas as well, got a flyer. And so it's a pretty inexpensive, it's a black and white, it's a fairly inexpensive thing to publicize, a lot cheaper than advertisement on a bus, for example. So it's just another way to do it, and you reach a different population.
Oh, it's perfect. That gets into the very hands we're wanting to get it into. Right. That's awesome. Thank you so much. Judy, go ahead.
I would suggest that maybe is even more successful than just posting, because some of these places where they post the flyers, you've seen them in the grocery stores, there's layer upon layer. Putting it in the bag, that's something that at least they're going to take a glance at, if not take time to read it. Mm-hmm.
Well, and again, if churches could put them in their church bulletins and things like that. And we could also, schools, if they're willing, I know schools are careful about what they send home because they get asked to send home a ton of stuff, but even maybe something through the schools too. But
the church bulletins, I've had success getting things into them. And that again is an outreach. It's a document people tend to maybe read.
Yeah.
And the area we haven't talked about that is, it's not my area, but all of the younger people. It's the mass media. It's the Facebook pages and the websites and the TikToks and all the other things. Right. Don't cost anything to get those on there, and you're reaching a whole nother segment of our community that we aren't able to reach in other ways.
Mm-hmm. And Amy, that's something, I know the health department has worked really hard the last couple of years to really beef up their social media presence. And I'm wondering if we could use some of what they've already, like how they've kind of done that, if we could just attach something to what they already send out or do through social media, whether instead of reinventing the wheel, why can't we just add something to what they're already sending out if they don't think it would detract from, their main message about a particular thing. So is that something you can kind of look into through, is that what health promotion that would be through?
I don't know if it's so much health promotion anymore. And then there's also just the, because that team is pretty small right now. Maureen, do you know if it's who's doing the social media right now?
Kim Anderson is over that right now. And Mental Health First Aid has at least a dozen or more infographics with different mental health issues. And we used to put them out once a month and have a group of human service providers who would then share them, or, we would mock it up and give it to Chestnut, or mock it up and give it to the Baby Fold or Children's Home and Aid. And whoever it was that month, they would share it, or they would post it, and then the rest of us would go share it. So I know that we've got at least 12 of them, because we did a whole year's, but I think we did 2 years worth that we could probably, recycle through our social media and share with other agencies to cycle through their social media.
Thank you. Okay, I'm really aware of the time. We've got about 10 good minutes left. So what I'm thinking about for the, so I think we also need to decide where else we'll need to allocate money, because we are talking about doing some flyers. We're talking about stipends for our community liaisons. Are we talking about Maureen? If Maureen is successful in getting more people to be willing to go through the training, and you said it's 200 and what did you tell me it was per person that gets when they have to get retrained to do the remote, how much it cost just for the remote?
It's $150 per trainer.
Okay. So do we think some of these money should be used to pay people for that 150 to be retrained? Does that fit the mission? It's not exactly marketing, but it's also going to let them be able to deliver a service that we want to market. So is that money we should allocate to pay existing trainers to get the additional training for remote? And then do we need to do anything about the additional cost for participants? If it went from, it was $10 before, and now it's gone up to 25, but you're saying, Maureen, you have some dollars, so it wouldn't have to be 25 per each attendee. Is that what you're saying? Do we want to defray some of the costs with that? And that's not exactly marketing, so I want to make sure we're not violating what this money's been set aside for. So I'd love y'all to weigh in on that.
Yeah, I think we could probably build the case that it is marketing, because if you think about the purpose of mental health first aid, it is to reach out and provide information and resources. So I think, we could probably wordsmith something and come up with it. But it probably is also worth asking the legal counsel for the department if we do that and we look at it as part of the marketing plan, are we okay?
So potentially $150 per trainer, right, Maureen?
Yep, I'd say not more than $900 there, because
Okay.
yeah, that would cover 6 of them.
Okay, and then what about costs of the materials for the participants? How much do you think we should set aside should we try to go for a certain cap of number that we're going to train and say that we'll pay for, the cost of the materials and the entrance fee for X number? Is that the best way to go about that?
Wow, that'd be awesome. I don't know how much, like $2,000 would give us 80 people through. And if they were paying $10 to $15 per person, that would actually get us more like closer to 125 maybe,
So Maureen, are you saying that we would pay a portion of their participant fee rather than all of it? Is that what you're recommending?
Yeah.
So they would pay something, which is not, I never think that's a bad idea, even if it's $5. And then we would pay you're saying up to how much per person?
Well, if they continued to pay 10 and we paid 15,
Okay.
so $1,500 would get us 1,000 seats,
Okay.
and we'd be
All right.
thrilled with that. If you could
Okay.
make it work, that would be
Okay.
thrilling.
Okay, go ahead, Judy.
That's okay, I'm fine.
All right. And then we talked about paying the trainers to do the, but again, we have to leave, I mean, I'm just trying to get a sense of how much do we want to put towards mental health first aid, because we have to leave money for stipends for the liaisons and all the materials and social media we're going to run to make sure that there's, you know, the community liaisons have flyers and things that they can give out, as well as us, you know, blitzing the whole community through both concrete stuff and social media stuff. So,
Yeah,
and
I would just
so-
like that.
all right. So right now we're okay. So what else can you all think of that we have not talked about? So I think, again, we kind of have a plan to get us started. It's about 4 steps we need to do. I think a first step too is going to be reaching out, having a I'm going to probably ask those of you that are interested to join me on a Zoom meeting or some kind of a meeting with United Way and participants to see, you know, where they were. Okay. You want to be on that? Okay. And I don't know, will that have to be Open Meetings Act if there's a couple of us and we can just ask for United Way to meet with us? It would, you're saying, Judy, if it's just 2, 3, less than 3, we could do it without an Open Meetings Act? Okay.
Mhm.
All right. All right.
I didn't say
You-
that.
Okay, all right. So I think I'll immediately try to arrange something with a meeting to get some people together. And I will also, if anybody has a already existing contact, but I'll reach out to Carl and OSF people too, to see, you know, where they might be with having some marketing that's already built in. Go ahead, Judy.
I was going to say that there's only 2 from our board that are on this group. And I would think that, I'm looking at Mary, you know, the advisory board is a different entity. So I would think the board is covered. And if Mary or
Okay.
some the advisory committee wanted to serve, I believe that would be considered another entity, but we could check that out.
Okay, all right, all right. So anybody else have, so we'll do that. And then the other thing we'll look into right away is I'll be sending out a list to you of these 7 groups we've kind of targeted and asking each of you, like, is there one or 2 of those that you would be interested in, you know, making the contacts with, because maybe you know somebody in particular. And if you would let me know which group or groups that you are willing to do some, trying to get some, you know, specific contact information from. And I think that will get us started. And thank you. This was, I feel, I mean, if I've missed something big, please tell me now.
Nope.
Okay, I think we've got a beginning plan. I knew this group would be amazing. So thank you so much for all the wonderful input. Again, go ahead, Amy.
So that my note taker said that you mentioned the 7 groups real quick. And so she just asked if you could
Sure.
even for her.
Okay, so we have the faith community, and that was Mount Pisgah Center for Hope, and I believe it's called African Episcopal Methodist Church. And then we talked about families, and that was going to be Head Start, WIC, Better Birth Outcomes. So basically WIC, or basically Head Start in the health department. And then advocacy organizations, NAACP, NAMI, and Not in Our Town. And then the group that Trish is going to tell us about, the Latinx one. Go ahead.
Mhm.
Somebody, okay.
No,
And then we talked about Tri-County Special Ed to talk about rural communities using their staff to identify who might be contact people in rural communities. And then somebody through barbers and hairdressing. And then we talked about senior services, and that would be the YWCA area aging and Faith in Action. And then we talked about low income Blooming Housing Authority. And how many is that?
8.
Okay, I can't add. And then we kind of said disability community, but I think I'm going to hold on that right now for Mark and Easter says, I think I'm going to not put that one into the mix right now unless somebody thinks that should be prioritized. Okay, I think we are at an ending point, trying to capture, we'll work together, Amy and Jeff and Taylor and I will work together to try to capture all this into manageable information to get back at you right away so we don't lose our good thinking. And if y'all think of anything else that you need that comes to you, shoot it at me as anytime.
So, real quickly, we do have an action item, and I'm not really sure if it needs to be an action item or not at this point, just to approve the next steps on the behavioral health marketing plan, which you just told us the next steps. I don't know if that needs to be an action item though, really.
Go ahead, Judy. Are you?
I think we are going to move forward on an action plan or something if you find that we need to have.
Thank you, Judy.
I'll second.
Trish, I second.
Been moved and seconded. Any further discussion? Okay, all those in favor, raise your hand.
This is
Okay.
Gabby.
And Gabby said yes. Thank you so much, Gabby. Okay, motion carries.
Good
All
night.
right, thank you again so much. We're off. Put
Well,
on your roller skates. We're going.
okay.
Corey, I'll
Thank
let you know what happens after the collaborative.
Very good. Thank you so much, Maureen. Okay, all right. See you all soon. Thank you so much. Bye-bye.